Okay guys, finally everybody has been requesting this. I'm getting so many messages. Initially this was requested by Nabby of Nabby Studio, so I'm going to give a shout out to dear Nabby. And I'm very happy that she brought it up because this is such a common and such a difficult issue, not only for the dermatologist to deal with, but also with people. It's a lifelong issue. People suffer silently, or they just don't know what to do, and that is the management of melasma. But guys, I am more into holistic. So yes, you can get your IPLs and your lasers and your RF needling. You can get that done by your local dermatologists or whatever you prefer. I am going to give you three amazing and fantastic pathways. So I'm going to provide you 3 strategies. You can take any which path that is going to suit you. I'm going to talk about everything in details. Whatever path that you choose is going to help you deal chronically and on long-term basis with facial hyperchromasias or melasma. Now, these 3 pathways are evidence-based, so it's going to include holistics plus medicine. So it's not only going to rely on holistic or alternative medicine, it's going to also rely on actual therapeutic medicine. So something that has some studies and it has shown benefit. It's a little bit new. This area is a little bit new because a lot of long-term studies still do not exist for some of the compounds. But the few studies that have been done have shown pretty remarkable long-term benefits. So I'm going to include those in those pathways. I'm going to tomorrow I'm going to systematically describe to you each pathway. So pathway number 1 that you can take for mild melasma. A melasma that is mild, but you want to deal with it in a very holistic manner. It's a very simple pathway. Number 2 is going to be more intensive. So this is for more deeper or more resistant or more persistent melasma. That is a slightly more, I would say, more medical-oriented pathway, and for that you need to get some tests and workup done. It has some contraindications. And then number 3, I'm going to provide you an alternate. So if pathway number 2 does not agree with you, you can try pathway number 3. I am sure some of you have gone for laser therapy, for needling, collagen induction therapy. You've tried IPL, you've tried acids, peeling, you've tried a lot of professional options. So initially that might have helped you, and then later on you realize that the melasma is back. The hyperpigmentation is back. The melasma is back. It's not going away. In fact, just a few months you were free from that hyperpigmentation patches, and then now they've come back despite all the money that you've spent and despite all the treatments that you had done. The melasma has come back. I am going to tell you one thing, that if you are serious and you really want to treat your melasma or your hyperpigmentation, and if you're very serious about it, you need to follow what I'm saying exactly to the T. If you're going to change here and there, you're going to omit something or you're going to remove something, it's not going to work. You need to exactly follow what I'm saying. You need to do the tests done that I'm going to tell you to get done. You need to go to your physician, get those tests done. You need to follow all the steps to the T religiously. You need to follow them. You need also patience. You need to give yourself patience and time. So don't expect that in 1 month your melasma is going to vanish. It's not going to happen. It's going to take 3 to 6 to 9 to 12 months. Now, there are various reasons why treatment can fail. So a poor outcome of a laser or a chemical peel or an IPL or whatever modality that your physician is using. The treatment outcome was poor because number 1, the diagnosis was not correct. So it was like not the correct diagnosis. There are different kinds of melasma. So maybe it was a dermal melasma and it was being treated like an epidermal melasma. Maybe it was only an epidermal melasma. Maybe it was a mixed melasma. So you have components of the dermal and you have more deeper components and then superficial components. So maybe the diagnosis was incorrect. Number 2, you are not taking care post-procedurally. What does that mean? That means that you went for your lasers or chemical peels, but you never ever took care of sun safety. So no sun protection, no sunscreen, you just went out into the sun. That melasma is never going to go away. So you can get the best lasers from the best doctor in the world. Melasma will not go away if you are going to be negligent with sun safety. So that is the second reason why melasma treatment fails, People get good treatments and then unfortunately they are not careful when it comes to solar radiation. That is going to never ever heal your melasma, and that is 100%, I'm guaranteeing you that. The other point, there are various reasons. So the other point can be that the operator or the person, the technician or the physician who is actually performing those procedures, so they're performing the laser procedure, IPL, whatever, they don't know what they're doing, or they're not that good. They don't have a lot of experience. They don't know the parameters. They're not actually treating the melasma as it should be treated, or the sessions have been reduced. There is something wrong there. So there are various reasons why melasma treatment can fail. Of course, other reasons are if you have a genetic, so 60 to 70% of melasma has a genetic tendency. If you have that, that is going to be a very persistent kind of melasma, and that's going to take a long time to treat. So family history, if you have a family history, unfortunately, it's going to keep on recurring. Now, there are lots of other reasons. So if your melasma is hormonal induced, so contraceptive, contraception, hormone levels, if they're fluctuating, so hormonal induced melasma, that can also be an issue. But then the good news is that once that hormone issue is fixed or it's withdrawn, the melasma will get better. So that's good news. Lots of other reasons are there. So if, for instance, essential oils, I'm going to mention this because so many of you are confused about essential oils. You use a heavily perfumed serum or a soap or some kind of material, a product containing essential oils, for instance, bergamot or lime. So you bought a really expensive serum and that says a beautiful antioxidant serum, and in the end there's lemon peel because they want to give it some scent. You apply that, you go out into the sun, you will have an immediate phototoxic reaction because bergamot, lime, these essential oils that are very aromatic are very volatile. They will react with the UVR of the sun, resulting in a phototoxic reaction. Those essential oils are going to result in a phototoxic reaction. That phototoxic reaction is going to cause inflammation and irritation. Irritation, then inflammation. Inflammation is going to excite your melanocytes. You will have more pigmentation, and you keep on using that product, and your melasma is going to worsen day by day. It's going to just keep on worsening. You will not know why it's getting worse. It's because you are using a product containing essential oils, perfume, or other phototoxic elements. And this is why when I said that when I mention something, please try to follow that. I get so many messages, so many requests. People send me strange products and names containing I don't know what. I'm sorry, but I cannot recommend anything like that. I'm very strict about that. There's no way I'm going to just tell you to start using a cream that I have no clue about. You need to use high quality products, especially when you're treating conditions like melasma. So either you're going to get them from your pharmacist, from your doctor, or if you get them online, you will go to trusted brands. So Ordinary is very good if that's available. Cuticonscious, Dr. Murad, Dr. Denise Grossman. I wouldn't go with Shiseido and Lancome in these because they're pretty high in perfumes. I would go with more these kind of brands. So Drunk Elephant, SkinCeuticals, I would stick to these. Dermalogica sometimes tends to irritate a lot of people, so I would not also go with that. Ordinary, I just mentioned Ordinary. So tomorrow, enough said. Tomorrow I'm going to give you 3 solid evidence-based pathways that you can take for resistant chronic melasma. They're going to be in a holistic approach. So tomorrow, enough said. Tomorrow I'm going to give you 3 solid evidence-based pathways that you can take for resistant chronic melasma. They're going to be in a holistic approach, alternate approach that you can try, and I hope that some of you are at least able to try it. Please be patient, give it 3 months, 6 months. Try it, and I know that it will really help you. It will help you if you follow what I'm going to tell you, and if you, of course, are going to be very vigilant when it comes to your health. So if you have any side effects, you need to stop. If you have a contraindication, you cannot do it. So I'm going to mention all of those to you guys so you exactly know what you're getting into. This is especially for those of you who actually are fed up. You are suffering from melasma from years and years and years, and you don't know what to do. So you are going for treatments, you are being so vigilant with your sun safety, but then the melasma comes back. So this is especially for those of you who really have a cosmetic disability and are willing to take those extra steps to kind of control your melasma and hyperpigmentation. So I hope it is useful to some of you. I truly, sincerely. Alright guys, so today we're going to begin pathway number 1. So pathway number 1 into the holistic management of hyperpigmentation. This is for mild melasma, for mild PIH, mild patches on your skin. It's going to help you, but please be patient and exactly follow what I'm saying. If you're going to change something here and there, it might not work. So let's begin with pathway number 1 to the treatment of hyperpigmentation and melasma. So guys, if you are going to follow my step number 1, 90% of your melasma is gone right there. So if you are not going to follow my step number 1, then your melasma, your hyperpigmentation, your PIH, acne marks, brown spots, sun spots will never go away. So please be patient, be vigilant, and follow step number 1 of my pathway number 1. I'm going to start with step number 1. Step number 1, if you're going to skip it, it's never going to work. So step number 1 is you need to get a broad-brimmed hat. What is a broad-brimmed hat? A broad-brimmed hat is a hat that has a wide circumference, and it prevents any light from hitting the back of your neck, the front of your neck, your face, your ears. It prevents you from getting a lot of sunlight in these areas. So a broad-brimmed hat, you need to get that. If you feel embarrassed or you don't like a hat or whatever reason, you need to get an umbrella. So I'm giving you 2 choices, a broad-brimmed hat or an umbrella. The umbrella and a broad-brimmed hat, you need to get that. And number 3 is sunglasses. So these 3 things you need to have all the time. If for some reason you don't like wearing, step number 2 of my pathway number 1 is topicals. So topicals is the mildest way in skin of color that we can treat really superficial, mild, epidermal kind of melasma. So really superficial. The top part of the keratinocytes have some pigment, so it's treatable. You need to follow exactly what I'm saying. So please look at what I'm going to say. Products that are available in your area, wherever you are, they need to be exactly matching to what I'm saying. So please try to match the products. I'll give you some options. I hope that they're available everywhere. So we're going to start with topicals. Now topicals require patience and diligence. You just cannot apply a topical and then just forget about it. You need to do it on a daily basis. In the morning, if you have oily skin, you can use an oil cleanser. That's up to you. But if you have dry, sensitive skin, I prefer in the morning, because you already cleansed at night, in the morning just do a water cleanse, because I want the lipids to remain there. The lipids on your skin, believe it or not, actually enhance the absorption of material. So people tell you that you have to scrub and cleanse your face in the morning. That is a myth. You're going to take a beautiful 15% vitamin C serum or a 25C booster by Ordinary. So I'm making it really simple. You're going to take that, and to it you're going to add a little bit of azelaic acid, let's say 10%. Now comes the moisturizer. Now, if you have oily skin or if you have reactive skin, it's best not to use a moisturizer in the morning, because all of the sunscreens that you're going to use will contain, we're adding a lot of moisturizers to the sunscreens anyway. So they're very hydrating sunscreens. So you can skip the moisturizer. Step number 3. Step number 3. All these steps are important, but it's also very important. If you skip step number 3, it's not going to work. So I'm going to give you a few options. You need to apply a sunscreen depending on your skin type. If you have oily skin, oil-free, sheer touch SPF 60 by Neutrogena is really great. If you have, let's say, dry skin, then I'm going to give you an option by CeraVe here. It has an SPF of 50. So apply no less than 50 SPF sunscreen. So it shouldn't be 25, it should not be 30, it should not be 20. It must be a 50 SPF. It can also be a 60 SPF, but it should be 50 and above. So I hope all of you watched my demo of sunscreen application. I had given a pretty intensive and a pretty in-depth demo on how to apply a sunscreen on your face. If you've missed that, then I'll either put it in the highlights or on the YouTube. If in case you have missed how to apply a facial sunscreen properly, then that was a very important one that you missed. So I'll try to put it on in my highlights or the YouTube. So you're going to take your sunscreen SPF 50 plus. You're going to apply it very carefully all over your face, neck, ears, like I mentioned in that talk last week. You're going to apply that, and 15 minutes before you leave the house. Now comes the night routine. Night routine, you need to remove all traces of makeup. I've said that a lot of times. A lot of the makeup, a lot of the foundations, the cheap quality makeup contains certain compounds that are going to worsen your hyperpigmentation because of irritating substances. They're going to worsen your melasma. So you don't want makeup on your face at night. Please use a double cleanse, oil cleanse, micellar water, not a very harsh cleanse, and you can use a very mild PHA cleanser. So the Neutrogena PHA cleanser is beautiful. So I'm not going to suggest lactic acid, BHA, AHA, anything. I'm going to suggest a PHA. PHAs have larger molecules. These are very safe acids. So cleanse your face with a PHA cleanser. It's going to mildly, gently exfoliate as well. And of course, remove your makeup. Then you're going to apply another topical. That is going to be 10% niacinamide with 1% zinc. Then with that, along with that, you're going to then first apply the niacinamide, water soluble, zinc, water soluble. So the water goes on first. Apply the zinc and niacinamide. Then you're going to top it up with squalene and retinol. So 0.2% retinol in squalene. This is a very mild strength of retinol. Now, usually I love to combine tretinoin, so the prescription retinol. Prescription retinols, first generation retinols, are powerful agents. They are the most powerful agents in dermatology. But skin of color, sometimes it doesn't do well with the tretinoins or with retinols. They tend to cause irritation, and it may worsen the hyperpigmentation, and I don't want to take that chance. So what you're going to do is you're going to take I'm going to actually suggest a really mild retinol. So a mild retinol are cosmetic retinols. They're retinol esters. They take a long time to work. They're not going to work as fast as tretinoin. I'm going to tell you from the beginning. Cosmetic retinols are totally different from prescription retinols. So cosmetic retinols are esters and they're milder. So I'm going to suggest a 0.2% retinol in squalene after you've applied the niacinamide. If you are a retinol user and your skin has been retinized, so you have been used to retinol, then a 1% retinol in squalene. Then you're going to take, so you've applied these to the patches wherever you have your hyperpigmentation. Then you take a good cream. Now, there are some fantastic creams. They're very expensive. So Peter Roth Thomas does an amazing correction cream. SkinCeuticals does an amazing correction cream, but they're really expensive. So $100 and above. At night, you can just apply a nice ceramide cream. I'm going to mention one here. Moisturizer with niacinamide and ceramides. They're going to strengthen your barrier and also take away the irritation that is going to come with the retinol. So select either a CeraVe, a Eucerin, La Roche-Posay. All of these are beautiful. Take a serum, take a cream, moisturizer according to your skin type. Apply that moisturizer. It doesn't matter if it has a million ingredients. It just should have the important ingredients. Should contain niacinamide, should contain licorice, should contain some ascorbic acid, should contain ceramides, some lipids, hyaluronic acid. Apply that moisturizer. That's really important because you want to reduce retinol-induced irritation. This is very, very important. So apply that few hours before you go to sleep. So guys, this was my pathway number 1 for mild hyperpigmentation, mild patches of melasma. You need to do this diligently every single day. It has to be done for any reason if there's irritation, so you need to stop it. Stop it, wait, dry again. Severe blisters and whealing, that means that ingredient is not suiting you. But if you have a mild tingling sensation, some redness, please don't worry, because that means that the active ingredients are actually helping your skin and your skin is accepting it. So do these steps every single day and you will see a difference. And this is going to be for really superficial, really mild melasma. So whenever I have become really busy, so I'm developing a lot of protocols for a lot of my labs, so I'm not going to be able to make it here every day, but I'm going to repost a lot of my older stories because they're just so amazing, and I'm sure a lot of you have missed them. So the pregnancy one, a lot of you have missed. I just did a poll. There's another few that a lot of you have missed, so I'm just going to repost those, but I won't be able to post the stories every single day. But whenever I get a chance, I'm going to then, day after tomorrow, whenever, I'm going to post the pathway number 2. Now, pathway number 2 of my holistic management of melasma is more intense. There's some contraindications. I'm going to give you the list of medical contraindications. You need to discuss it with your local physician wherever you are. It's a little experimental, but it's really showing great results. So I want you guys to try it. If you really have chronic resistant melasma that is just not responding to lasers, to anything, you need to try this. So pathway number 2 is going to be my next talk. Pathway number 2 for more chronic and resistant melasma, and then the last part will be pathway number 3. So stay tuned, take care, and I hope that all of you are well. And please only send me really important messages. Alright guys, today I'm going to conclude my pathway number 2 and 3 for the holistic management of melasma. Now please remember, what I'm going to do is I'm going to actually post the demonstration of how to apply facial SPF for you guys in my highlights. So you can go back and refer to that because you need to know how to apply it. I'm not going to repeat all of it again. So I'm going to put that in my highlights. Please have a look at that. And then you need to remember with pathway number 2, this is going to be carrying some contraindications. So if you cannot take this route, then I'm going to mention pathway number 3 for you. So for pathway number 2, what are you going to do? You're going to carry on with number 1, as I had mentioned yesterday, sun safety. So sun safety is a must in all 3 pathways. That is a constant. You cannot help your melasma if you're going to skip that step. So pathway 1, 2, and 3 have this in common, that you're going to continue with your sunscreen safety as much as possible. And then, of course, you're also going to use the topicals. Now, topicals are something that you need to use all your life. Just adjust them according to the irritation levels and whatever. But topicals are also going to remain the same, adjusted according to the weather, skin type. Sometimes you may need less of something, so that is going to be adjusted, but you will continue with sun safety and the topicals like I mentioned yesterday for pathway number 2 and number 3. So what is the important thing that I'm going to add for you guys? Now, this is being used by some physicians in some parts of the world. Not everybody's going to use it. It's not mainstay. Very few studies, still experimental, but it's enough. We have enough information that we can give this molecule and then, of course, observe the different levels of outcome. So what I'm going to add for you right now is something which is used in menorrhagia. So it's used for treating menorrhagia in obstetrics and gynecology. Now we're going to transition it into dermatology. Discuss this option with your physician. Wherever you are in the world, go to your local physician and discuss this option. If everything is all right, your blood work is good, you don't have a contraindication, you don't have a positive family history of the conditions that I'm going to mention, you can start with this. It's relatively safe. There are some side effects, but then you need to know that. So that's why I'm going to mention the contraindications to you. I'm going to add for you 250 milligrams twice daily of tranexamic acid. Now, how does tranexamic acid work? Well, it has different ways of working. It affects the fibrinolytic pathway. So the pathway that is involved in the clotting of your blood, that is where the tranexamic acid is going to act. But that's a different indication and different dosages. For melasma, the dosage is 250 milligram twice daily of tranexamic acid. that is given every single day over a period of 3 months to 6 months to 12 months. Results have been that have been coming in. People start seeing a difference in their melasma in about 8 to 9 weeks, which is quite fast actually. So you will take tranexamic acid along with the topicals and the sun safety. This molecule, it's going to come, this product is going to come in a bottle. So it's going to be professionally dispensed. And then what you're going to do is start observing the changes. So you're going to hopefully see some benefits in about 6 weeks, 8 weeks. And then in some people it may take longer, but hopefully tranexamic acid at this dosage will really help you dealing with melasma on a more holistic or a more internal manner. As with all chemical compounds and as with all medications, you need to be aware of side effects. If you have a lot of stomach upset, if you have painful periods, if you have certain side effects, you need to then not take it. So that's what I said, that it has contraindications. Now you're taking something from your mouth, and so therefore it will have contraindications. It may also carry some side effects, so you need to be aware of that. So that's why I said that pathway number 2 is more intensive. It's for people who really who are desperate, who have chronic melasma, and they just want to take care of it in a different manner. So how you're going to do this is pathway number 2, topicals, sunscreen, and then tranexamic acid, 250 milligrams twice daily. Try it for 3 months, and then if you're able to tolerate it, you can go on and try it for 6 months or 12 months. And you need to discuss all of this with your local physician before you begin. Now, if you have a contraindication, for instance, so you have any fibrinolytic coagulopathies, you have renal issues, you have a problem and you cannot take tranexamic acid, so then what are you going to do? Then I'm going to share with you pathway number 3. Pathway number 3, we're going to continue with our topicals and our sun safety. We're just going to take away the tranexamic acid. That was for pathway number 2. Pathway number 3, I'm going to include another supplement for you. I'm sharing a few brands here. Please see if you can get a really good brand in your area. And this is known as Polypodium leucomotus. So Polypodium leucomotus is a fern, it's a plant, and what they have discovered is this has extremely excellent photoprotective abilities. So it's kind of an oral sunscreen. So you take that, and that Polypodium leucomotus is going to prevent the burning, it's going to prevent UVR damage, it's going to prevent the effects of the sunlight on your face. It's a natural photoprotective supplement. The additional benefit is that it's going to also lighten your melasma. So this is pathway number 3. You're going to take about 250 milligrams of Polypodium leucomotus about 2 times a day. You're going to keep on taking it. The nice thing is it has no contraindications, and it does not have a lot of side effects other than stomach upset, heartburn. So you need to watch out, because whenever you take anything, even if it's vitamin C or vitamin D, even the simplest of vitamins, you need to look out for side effects. If you have side effects that you can cope with, it's fine. If you're not able to cope with them, you need to stop. So for those of you who are skincare lovers and skincare and science nerds like me, if you want to know how tranexamic acid works, you're welcome to go to reliable scientific sources, and you can read up all about that. I'm going to tell you a really, really quick science fact sheet on how it works. So how tranexamic acid works, number 1, a lot of about it is not known. But then what we do know is that it prevents the talking. So it's going to prevent the texting between the melanocyte and the keratinocyte, which is interesting. So the melanocyte, the poor thing, is going to make its pigment, but then the texting is not going to be happening between the skin cell and the melanocyte. Therefore, the keratinocyte is not going to be pigmented, and the pigmentation is going to slowly lessen over time. Now, if you want to take it a step further, I would, this is good for your hair, for your nails as well, and for your skin. You can add also collagen peptides. So hydrolyzed collagen peptides, please combine it with 1,000 milligrams of vitamin C and 1,000 milligrams of vitamin D. Vitamin D is essential for everyone. Wherever you live, regardless of anything, you need to take vitamin D. So vitamin C, 1,000 milligram, vitamin D, and oral collagen hydrolyzed peptides. Now this collagen, vitamin C, and vitamin D can be taken with pathway number 2, with 1 and with 3. So you can actually use all my 3 pathways and you can add this collagen. And if you don't have melasma, you just want to improve the quality of your hair, nails, and your skin, you're welcome to try a good quality like a Neocell or some good quality collagen. Just add vitamin C and add vitamin D and have that daily. Mix it in your smoothies or just have it on its own. That is a skin supplement as it is. So that's going to help you, but it's also going to help lessen your melasma. So guys, this was the concluding part of my holistic management of melasma. I hope that it's useful to some of you. Try, see if you are a candidate for tranexamic acid and also for Polypodium leucomotus. So I hope that these 2 oral supplements are going to help you dealing with chronic resistant melasma that is just not going away. Now you're using an inside-out approach, which is my favorite approach. You're using a holistic inside-out approach. You are targeting certain pathways of the pathology. So you're targeting the melanogenesis and the melanocyte itself by using these 2 compounds that I've mentioned. And therefore you are taking care of melasma internally. So I hope that these protocols, they help you. Please, I'm going to of course say this again before I go. Please be careful because they're oral supplements. So you need to be in good health. You should not have any of the contraindications. And then when everything is all right, you can take it. Now, again, if you suffer side effects, so if you feel that this is not agreeing with you, then I'm sorry, but you need to stop it. I'm never ever going to tell you to take something if it's dangerous, number 1, and of course, if you suffer side effects. So if you suffer side effects, if you are not a candidate for these 2, then you need to just continue with pathway number 1. You can continue that with your lasers or any other treatments that you have been taking. But pathway number 2 and 3 are pretty effective. In fact, 86% of patients and more are quite happy with these 2 compounds. So take care, guys, and see you again with another interesting topic.